I'm often asked, what is a long-term acute care hospital? My definition is that a long-term acute care hospital is an acute care hospital that specializes in the treatment and rehabilitation of medically complex patients who require a long length of stay. When a family is trying to decide which post-acute care setting their family member should go to, a nursing home, a long-term acute care hospital, or a rehab center, there's one basic question. Does the care need to be directed by a physician in an LTAC, a nurse in a skilled nursing facility, or a rehab team in a rehabilitation hospital? If you need a doctor every day, available at all times, you need to be in an LTAC. Our patients come from a variety of sources, but primarily they come from short-term acute care hospitals, probably about 95%. And that fits our model because our patients are patients who have a large variety of complicated medical conditions all occurring at the same time. Those folks usually end up in a short-term acute care hospital before they come to us. Our long-term acute care hospitals are full-fledged hospitals. We have licensure, accreditation, and certification to the same standard as any community or university hospital. The interdisciplinary team is made up of those clinicians that have a stake in the patient's recovery. It is led by, of course, the attending physician, nurses, pharmacy, nutrition rehabilitation, occupational therapy, speech and language pathology, as well as physical therapy. And these 7 or 8 people set goals, mark progress, and coordinate the care so that the outcome can be as best as it possibly can. Our patients are as sick as patients in short-term acute care hospitals. However, our goals are different. In the short-term acute care hospital, the goal is to keep that person going day to day. In the long-term acute care hospitals, the interdisciplinary team's job is to look at the entire patient to decide what are their medical conditions, what is their treatment plan, what are some reasonable goals, and then to coordinate everyone's interest around meeting those goals. And those goals are not, will they make it through the night? Those goals are, what do I want the patient to look like 3 days from now, 7 days from now, 2 weeks from now? The simplest way to contact a long-term acute care hospital is simply to talk it over with your healthcare team in your short-term hospital. The physician will write an order to ask a long-term acute care hospital to come out with their representatives and make an evaluation to evaluate the situation and determine whether a long-term acute care hospital is the best place for your loved one. The fundamental question is the best place for me as a patient in a hospital where people like me make up only 1 or 2% of those patients? Or is it in a place that is filled with people just like me, with a large burden of illness, with a lot of complexity, and a place where the staff looks at me and says, I recognize this type of patient, I know what to do, I know how they're different, how they're unique, and how they're special. This is what we do. We can provide for you and your loved one what you're looking for: hope, healing, and recovery.